Hello and welcome to week 7 live chat. This week, we are going to talk about something that is very important, both as a healthcare professional that you must know, but also as a patient or the loved one of a patient. And I know I say that about a lot of what we discuss because it's true. All right. Remember that this is the 21st century. And the important thing about the internet and patient portals and websites like Medline Plus is that patients now have the opportunity to gather information and discuss it with their healthcare professional as a team. This is very, very important because, you know, humans are humans. And we may think of physicians and other healthcare professionals as being all-knowing, but you know what? Nobody can be all-knowing. This is very, very important. So I want you to remember that all of the education that you're getting here has multi-benefit for you and your family. Okay. All right. So let's talk about informed consent. You know that every time a physician or any healthcare professional touches you, they are required to get your consent. And any healthcare professional that touches you against your agreement can be charged with assault and sometimes assault and battery, because nobody's allowed to touch you without your permission. And that is a blanket absolute statement. Okay. So we always have to go that next level as healthcare professionals and as patients and make certain that we understand what exactly we are consenting to. It's not just that the person in the white coat or the scrubs is telling us, you need to have this, you need to have that. You really need to understand and understand all aspects of the procedure or the service or the treatment. So you can make up your own mind as the patient or as a loved one of a patient to discuss further. This is really important because, and we have seen it now throughout the world, and particularly here in the United States, all of these people who are against getting the COVID-19 vaccine. Now, you may understand this, you may agree with this, you may not understand it, you may not agree with this. That is fine. But the long-standing principle that is required of informed consent, which is guaranteed to you by the United States Constitution, is that you need to understand fully what is going to happen before it happens, and it can only happen with your agreement. Okay? So and this is a legal concept. As I said, it's guaranteed by the United States Constitution. Informed consent is the process in which the healthcare provider educates the patient about the risks, benefits, and alternatives of a given procedure or intervention. This can be as little as a flu shot or as great as a heart transplant surgery. But it is important that you understand that the patient has the power of agreement. It is the healthcare professional that's supposed to know the standards of care and what to do to help fix whatever it is, okay? However, you need to understand as a patient, you need to make sure that informed consent is given as a health information management professional. Now, if the procedure is large enough, and I actually, in my doctor's office, when I got my flu shot, I had to sign to say, yes, I agree to getting this, to having this, okay? It is always best to have a signed consent proof, but the patient should not sign it unless they really understand and agree, okay? Now, of course, the patient must be competent to make a voluntary decision about whether to undergo the procedure or the intervention. And there are cases where the patient may be borderline, okay? And I know your mind may be jumping immediately to elderly, and that might be true, okay? But it's really all ages, right? Not everybody has a college degree. Not everybody can understand these advanced processes. So we must find ways to help them so they understand, so they know what they are agreeing to. This is a mandate for the United States legal system. This is a law, okay? All right, but it's not only a legal issue, it's an ethical issue. You don't want to be doing stuff to people against their will. That doesn't sound very democratic, and it's not, okay? The law states, and you want this from an ethical, and as healthcare professionals, we want this to protect us, okay? Implicit informed consent means it's signed on paper, or it could be an iPad, okay? But the point is that the patient makes a signature saying, proving, yes, I understand, and yes, I agree. We also very often will have informed consent forms that at the bottom may say, no, I do not agree. This is an important part of our freedoms in the United States. So it is very important that we as health information management professionals make certain that this documentation is in the patient record. And like I said, you know, we don't do too much on paper anymore. Everything is electronic. So often the agreement is going to be, like I said, on an iPad. That's okay. But if you are there as the patient is getting ready to sign, you might want to just say, make sure you read this, okay? Make sure you, if there's a concern, all right? Now, if there is a concern to a patient's competence, then you want to make sure that there is a guardian for a child or other ways that you can help this patient understand. We just don't want to get into a position where a patient is signing and they don't know what they're signing. You don't want it happening to you. You don't want it happening to your grandma, and certainly not to anyone who does not have the intellectual capability. And you know, this is not an insult. This is fact. We have people in our world that have intellectual capabilities that span, okay? I have a grandniece who is 5 years old, who is this unbelievably smart for her age, okay? The point is that intellectual capability to understand certain things is not necessarily dictated by one's age or even by what grade they graduated. But it can be ferreted out as a conversation is occurring, okay? Protection of yourself, protection of your patients, protection of your facility. All right. The Joint Commission requires documentation of all of the elements of informed consent in a form and usually it is a form, a progress note, or elsewhere in the record, it must be documented. And do you remember probably earlier in your education here, you learned if it's not documented, it didn't happen, right? Well, the same thing goes with informed consent. If it's not documented, it didn't happen. All right. So as I just said, all of the elements of informed consent are required to be documented as gone through with the patient and the patient's family, if that's what the patient wants. Okay. All right. So you have to know what the requirement elements are. First, the nature of the procedure. And this basically means are we talking about an injection? Are we talking about open heart surgery, which they don't really do much anymore, but you get my understanding. Is it a laparoscopic procedure? What is the nature of the procedure? Okay. And of course, included in that should be the standard of care for attaching the diagnosis, the medical necessity for the procedure. Okay. Second, both the risks and the benefits of the procedure. If we do this surgery, you will no longer have pain. You will be able to eat whatever you want, whatever, okay? But also, if there is general anesthetic involved, they must discuss the risks of the general anesthetic. Now, there are some doctors who are wary of discussing risks because they're afraid that the patient will get scared. I could die. Okay. And then they'll refuse the procedure, even though they really need it. This is a gray area in judgment. But the fact is that yes, anybody can die at any point in time. Yes, under general anesthesia, there is the possibility that the anesthesia can kill a person. We try not to dwell on that because there are a lot of procedures that are necessary. And I don't think that you want to have your gallbladder taken out and be fully awake. Okay. The fact of the matter is there are always risks, and hopefully the benefits outweigh the risks. Okay. Reasonable alternatives. Now, there are some procedures where there is a mixed return from medical versus surgical, okay? In other words, well, you can have a procedure, you'll be in the hospital for 5 hours, you go home, you'll heal, and then that'll be that. Or you can take this medication for the rest of your life every single day, okay? But the fact of the matter is this needs to be the patient's decision, not the physician's decision. Now, the physician is not barred from saying, I really, really, really think this is a good idea. You really need this, okay? But it's still got to be explained. Risks and benefits of the alternatives, okay? So if we use my example, the risk of being on a medication every day for the rest of your life could become financially difficult, could cause an interruption in the quality of life. There are various things, but that's just off the top of my head. Okay. Risks and benefits of refusing the procedure. Now, remember, all of this time we have been talking about ways to get the patient to say yes, because the physician feels that this procedure, whatever it might be, is necessary, is the standard of care for the best care for the patient. Okay, understood. But we also have to explain to the patient, now, if you say no, here's what could happen. You know, we talked about the risks of general anesthesia, for example, which is very tiny and low. However, the risk of refusing the procedure may be greater, maybe could cause other signs and symptoms, that also could cause death. Okay, I don't know. It all depends on what we're talking about. And then finally, there must be a statement in the record that the physician has, or the healthcare professional has indeed assessed the patient's understanding of elements 1 through 5. This has to be more than, did you understand what I just told you? Great, sign here. Okay, now, of course, again, we are talking about varying degrees of how much this gets involved with the difference between giving somebody a flu shot versus a surgical procedure. But the point is that we must remember healthcare professionals and patients have to work together as a team. This is no longer a one-sided conversation. And sometimes patients have to kind of stand up for themselves, okay? But it's important that you understand. It's important that the patient understand. And it's important that you get it in writing. Sorry, yeah. All right, this week you're going to read about, in chapter 7, medical records and informed consent. What a coincidence. It's not a coincidence. I pay attention. Okay. Do your homework for chapter 7. I also put in a handout for you in the content on informed consent. Physicians themselves, rather than a representative nurse or other related healthcare professionals, are the best choice to speak to the patient about informed consent. Now, what you may find is the physician will talk to the patient will agree, and then the nurse will come in with the consent form to sign. And there are patients who will feel more comfortable talking to the nurse because they're less intimidating, and discuss that with them. But it's all got to be according to the law and according to our ethics, okay? All right, now you know. No. All right, this is, we're already at the midterm point. How exciting. Boy, time flies. I can't believe today's March 1st. Really? Seriously. All right. If you have any questions at all, if you're not sure what questions to ask, we can make an appointment. We can email back and forth. We can make an appointment to speak on the phone. We can Skype, we can Zoom, we can FaceTime, we can do WhatsApp. Okay, I am flexible, whatever makes you feel comfortable. What's most important to me is that you obtain the knowledge you need to have a successful career after graduation. That's all. Have a wonderful, wonderful day. I'm here for you.